Welcome to another episode of Boardroom Reflections Stuck to Strong, where we go beyond headlines to explore the people, the ideas, and innovations that are quietly reshaping industries from the inside out. Today, we are stepping into the future of healthcare and the technologies and individuals who are promising to disrupt it. I have two guests today, Dr. Rajeev Khanna and Dr. Gurdeep Chhabra, both of whom are well known to me in my practice. Yes, I practice here in the DMV area next in Northern Virginia and Washington D.C. Dr. Khanna is a former chairman uh, of Department of Medicine at HCA Ruston Hospital, a board certified internist and a current board member of Loudon Medical Group, and is is also the CEO of Ayora Health, the health technology and health services company that we are going to be talking about. And he is joined with his C-suite colleague, Dr. Gurdeep Chhabra, who, who has an equally impressive list of accomplishments. He is a president of the medical staff at the University of Maryland Capital Regional Health Services. He is also the president of the Greater Washington Association of Physicians of India. So, with both physicians were brought together by their observations and witnessing of the growing pressures on healthcare, namely shrinking physician autonomy, increasing physician burnout, administrative overload, and a system that increasingly pulls doctors away from what first inspired all of us to enter medicine and care for patients. But rather than simply accepting that reality, these two physicians decided to build something different. What initially transpired as an innovation for their own personal practice and patients has now grown into something far larger. I recently had the privilege of seeing Ayora Health's platform behind the scenes and having a personal discussion with both Dr. Chabra and Dr. Khanna, and I have to tell you, I was genuinely impressed. This is far more than just another fancy technological application or another uh, peptide longevity program. What Ayora Health has been drafted and created is to perform as an integrated physician platform that will design that is designed to transform overwhelming amounts of clinical data into meaningful, actionable intelligence that is understandable by both patients and physicians, and simultaneously giving the physicians the infrastructure to build financially sustainable longevity and wellness practices without sacrificing the same insurance based practice that they have spent decades creating. This is an ambitious vision that seeks to return decision making power to physicians, create better patient outcomes and experiences, reduce burnout among healthcare providers, and help independent practices thrive in an increasingly vertical, integrated, and complex healthcare landscape. Today, we'll explore not only the technology but also the thinking behind it. We will discuss the future of longevity medicine, artificial intelligence, physician entrepreneurship, and perhaps most importantly, what healthcare could look like when doctors are once again empowered to practice medicine the way they always hoped they could. So, without further delay, please join me in welcoming Dr. Khanna, CEO of Ayora Health, and Dr. Gurdeep Chhabra to Boardroom Reflections Stuck to Strong. Welcome, gentlemen.
Thank you for having us, Dr. Iyer.
Thank you, Dr. Iyer. Thank you for the great introduction.
Yeah, this is really a pleasure to have you, and I know both of you for many years. Dr. Khanna has a 30-year career, out of which 28 years I have practiced as a colleague, and we have shared patients. So both of you are well known to me, but never in this capacity as we are talking today. It's always been in the realm of either caring for a patient when we are covering for each other, or an oncological patient that I needed to have specialty services from you, Dr. Chabra. So the questions that rose out of our initial conversations as we led up to this meeting indicated that today's dialogue is not about longevity medicine, it is actually about the reinvention of private practice and the future of personalized healthcare. And the million-dollar question, Dr. Khanna, the question goes to you, is that you gave me a very intriguing startup story. And it literally was a million-dollar question. So would you care to say a little bit about that?
So, first of all, thank you for the nice introduction and build up. Um, as you know, I've been in internal medicine private practice for the last literally 30 years in Northern Virginia, and getting busier day after day after day, and at times feeling burnt out, and my kids also imploring me start thinking of retiring. But I love what I do, so it's difficult to contemplate the retirement part. So it all started on a bright, sunny morning, a breakfast in a friend's house, expensive condo on Miami Beach, and this guy is already made it to the higher echelons, a very successful lawyer, a billionaire. So he goes out to 10x Health. That's a very famous wellness and longevity healthcare services out of Miami. So he throws a bunch of labs in front of me on the table and tells me I'm spending so much money so that I can live longer and live better. And I'll write $1 million check to you right now if you can promise me that you'll prolong my life by 5 years or maybe 4 years. Well, I was a little taken aback. So I said, well, I'm a reasonably good physician, and whichever way I think back on my teaching and my practice, there is no way or no possible reason I can say that, okay, here, you're not going to live 82, now you're going to live 87. There's no way I can promise or say anything. And that also left me with an intriguing thought. So I came back and started researching super wellness and longevity. And I found out that there was some scientific truth behind it. But then, as I delved more into it, and it became more and more clear to me the amount of information that's out there, how well that can be parsed into a meaningful result for the patient is again a totally different ballgame. So this started me on this journey, and combined with the thought process of cutting down on my work, brought me to like a niche hybrid model, because I couldn't go pure concierge and start seeing all the patients, and but I wanted to do something different for what I was doing every day. So that's how I started this journey. So
Wonderful. So you you your statement that physicians can never promise to extend life, um, uh, but they can often improve the quality of life that years that people have left. And I heard Gurdeep tell me one time that there's a difference between a long life and a good life. So Gurdeep, can you amplify on this? How do you define this difference between lifespan and thrive span?
So, I'm an oncologist by profession, so I deal with that on almost on a daily basis, where we're talking about different applications of chemotherapy, immune therapy, different modalities for cancer care, and majority of the cases we discuss this repeatedly about how long do you want to live, or what kind of quality of life you want to have. So I think that's something very innate and natural in what I do as an oncologist, and I think it is kind of what I find the most difficult is the fact that with patients being bombarded with information suggesting that they're going to be living much longer if they do certain things, and which is, it's not clear whether there's enough evidence for that, and that's the reason why we kind of also put this together, was trying to figure out if we can come together with a more of an evidence-based approach, which a clinician, a daily practitioner can use on a day-to-day basis with every patient who's walking through, not only with a patient who's got $1 million wants to write a check for $1 million, but as just making sure that we're be able to provide that at the same time, not promising things that we really have no control over.
That's that brings me actually to something that I had planned to actually ask further down later, but you opened that Pandora's box so well about evidence-based medicine and the volume of evidence. Modern medicine really generates so much data, hundreds of biomarkers, genomic reports, imaging studies, longitudinal health records. And I have patients who leave my office with they bring off to my office a binder full of information from diverse sources, and they have no clarity. Uh, and Dr. Khanna, for example, this patient that you had, this lawyer friend of yours in Miami, he dropped a thick stack of labs in front of you. All of that generated from this other longevity platform that you mentioned. Now, did he have clarity? And and my question is,
Well,
why has healthcare become so good at generating this information overload and so poor to convert it into meaningful clinical intelligence? And we have evidence-based medicine, like now we have open evidence. Everyone is, but how do you see
so
what you
so
do as helping physicians
yeah.
give clarity to their patients?
So going further down the journey, when I took his stack of paper, and I'm a board certified internal medicine physician. When I looked at all those genomic reports and the gut lining studies, half of the things I'm aware of the names, I'm familiar with the terms, but in fact, it was even difficult for me to interpret those things and parlay into a common clinical summary or clinical recommendation that I could give to the patient unless and until I sent him with those reports to a geneticist or to a specialized person. It was even difficult for forget about the patient and understanding those things. It was even difficult for as an internist for me to put it all together. And when I asked him, how much do you know of what tests you've done? He said, I got a 15-minute conversation with a nurse practitioner from the company. And that's why I'm kind of looking for more answers or looking more to understand. So I came back home, and in fact, I ordered those tests on myself personally. And then, in fact, when I attended seminars, how to read those results, how to interpret those results, it did help me to understand and started on this journey of learning how longevity medicine is perceived. I spoke with a transplant cardiologist out of Northwestern University, and he was setting up a longevity clinic as we spoke. So basically, longevity industry, this super wellness is not more than 2 3 years old. That people are becoming more and more aware of what needs to be done, and so all that information coming in. So the idea came to my mind: two things. One, my fellow physicians need to know this is happening. That's where medicine is headed. And secondly, how to parlay all that information into a concise clinical recommendation that I can put it in simple words for my patient. That was the idea that gave birth to Ayora platform and Ayora Health app. So Dr. Chabra and I, we go back. He's probably he not probably he is the first a person. I walked into my residency program as a PGY1, and I was responsible to him. He was my PGY2. So I've known him for literally forever and forever, for as long as I've been in US. So I reached out to him. We sat down together. Being a oncologist, I think he is more aware of the mortality. people than anybody else. So he was also intrigued, and he'd been working on it. So we gave birth to this Ayora platform. So I'll let Dr. Chhabra say a few words as to how it came about. Gurdeep?
Yeah, so thank you, Dr. Khanna. So I think one of the things which I find very much has been happening in medical oncology, and you guys have heard about this, we've been doing a lot of next-gen sequencing where we sequence the tumor and we find multiple different mutations, but it's only a few of them which are actionable. I think longevity medicine is also very much at that stage where a lot of data is coming in, and the question is, what of it is truly actionable and applicable to each and every specific patient? And to be able to do that for a practicing physician is not that easy. And that's where, with Dr. Khanna, of course, he's very unique about when he makes his mind and sets his mind to something. We kind of sat and we figured out, we felt that we need to create a platform where multiple different practices could be a part of the platform, engage with the platform, and what we would provide with the platform is a solution for them to be able to intake all this information that's coming in and see how they could apply it to their individual patients. That is the most important things, because these our physicians right now are, people talk about concierge, people talk about large practices. The problem is, if we don't take this into our own hands and start learning this very quickly, we will lose the respect of our patients. And we feel that's very important for us to be able to inculcate this with the use of AI, with the use of this platform on a day-to-day basis for each and every physician who becomes a part of this platform.
I completely agree. Today I had a patient who has a high level of commitment and respect to what I offer, but he is affected by the fact that the current healthcare environment restricts him to just 15 minutes. And in that 15 minutes, he's not able to get enough information to address the questions that he comes to the clinic with. And as a result, he goes to Reddit, he goes to all kinds of internet sources. And I'm not going to say that internet is bad, but the problem is it provides information without context. And with that, he arrives at certain conclusions that lands him in more trouble than otherwise. And this platform that you have created allows physicians to focus on delivering the quality they need to the patient. But Dr. Khanna, you mentioned something else about a crisis in healthcare, the physician burnout. And do you
So,
really believe that physician burnout has become the number
well,
one uh, problem
uh,
for healthcare right now?
no, you don't have to listen to me. Just read the newspaper. Just read the material. This is number one issue facing healthcare system in United States. So being the reimbursements for the physicians going down day by day, number of patients increasing. There are not enough primary care physicians. Students graduating out of residency programs are opting more and more for specialized fields rather than getting into primary care. So their physician burnout is a huge issue. I'm part of a very big Loudon Medical Group, and on their board, when I hear people talking, one of the biggest complaint is in the primary care practices is that they cannot find they can find nurse practitioners or medical assistant, but they cannot find MDs or physicians to join their practice. There are not enough out there, so they are getting swamped with the patients and daily pressure from the insurance companies to do a quality based analysis of the patient. So all the data is coming in. They have to sit down and check each and every box so that they can get paid. That's taking its toll on the patient. So physician burnout is number one thing. We are already, like, I'm already on my kind of west side of my practice. So it's time to cut back. But if I try to find a physician to replace me, I cannot. And on the other hand, I want to slow down on the working. So I would get help from the nurse practitioners and all. But physician burnout is a very big thing. I want to provide quality care to my patients, but that's not enough to pay for my even rent. So that's a conundrum we're working in. So that led us to kind of find a hybrid formula where we can do some concierge or membership based, where I can do provide a quality care to the patient. They have enough time, but they are able to pay for it and do all these tests and put them all together, work it out. On the other hand, I'm also continuing with my regular patients who cannot afford to be in any kind of membership or concierge practice.
So
So I
how do
feel
you?
obligated to take care of them also.
Yeah. So th- so that is the crux of the matter, that physicians would like to have ability to have the time to devote the quality and practice at the top of their license, whereas industry is pushing them to the bottom of their license to make them into what I call McDonald's medicine. Just burger, French fries medicine keeps body and soul together, but not much else. And here you have a Michelin star chef as a physician being forced to flip burgers on the assembly line of today's healthcare. So yet physicians are scared to go 100% in membership. And this hybrid model, what does that model look like, Dr. Khanna? And how do you believe it represents the future of independent medical practice?
So, there are hybrid models available when you look at the industry, especially that are supported by certain concierge care companies, and basically, but they recommend that the main physician who wants to go into concierge should go into concierge fully, and to take care of his regular patient, he should hire ancillary providers like nurse practitioner, family nurse practitioners, or physician assistants to take care of their regular patient. On the other hand, I have set of patients, unless until they see me as their physician, they are not satisfied. They would actually walk out of the room and wait for me to be free and to see them, or drive a certain amount of distance to be seen by me. So that's where my hybrid model is, that I assign a couple of days to my membership based practice, and rest of the days I try to see as many as possible my regular patients. And the days that I'm doing my membership, I start by having some compromise that the physician assistant or nurse practitioner would see patients or help me out on those days with those patients. So it's a moving part, and I'm hoping that it'll eventually settle down. But that's what where I'm headed.
Gurdeep, your uh, you are a C-suite member of Zasti AI. Can you tell us a little bit of how AI can potentially help the problems that Rajiv has pointed out in terms of becoming a force multiplier for the technology of physicians? So the physician has an expertise, and he's he's trying to he's being forced by industry to bargain himself on the basis of time rather than knowledge. And time is the one commodity you can't have more of. So how do you see what you do in the field of AI as a force multiplier for physicians? And how did you bring it into your Ayora Health platform?
Yeah. So what I feel is that this what AI is helping us is democratizing information and helping us to bring in a way where the technology will help the physician rather than the physician work for the technologist. Okay, and even though I was with the with Zasti, I'm more at this time. This is a more of a kind of a my way of realizing that it's the physician who needs to build the AI around patient care, and that's what's the most important thing. So now going back your question to your very specific question, what's Ayora Health doing? So what we've done at this point is we've figured out a way where, oh, yeah, I'm sorry about that. as I was talking to, as Dr. Khanna was just mentioning, uh, essentially what we're trying to do in this platform is kind of find a way where we can provide what we consider as a little bit of a secret sauce right now to each individual practicing physician, a way of being able to get the information that they're getting a whole on the patient itself. Let's say if a patient comes in, 60-year-old patient, has got hypertension, diabetes, hypercholesterolemia. Dr. Khanna runs a whole bunch of regular blood tests on him and then runs a bunch of biomarkers that the patient is willing to undergo. And so each patient, and the thing is that Dr. Khanna is extremely smart about and has done a lot of research on longevity and how it applies to each and every patient that's walking through his door. What we're trying to do is give each practicing physician the same kind of tool that will be able to use that in their individual practice as they're ordering these biomarkers. Because a lot of us, I mean, taking a page out of oncology, we learn on the go. Every time, every 2 or 3 months, new things are coming out. But we got to learn. There's got to be a lot of self-learning. And this self-learning is quite difficult. But what we're trying to do is with this secret sauce, help them provide this self-learning and be able to apply it to the patient, within minutes, so that when the patient leaves, he leaves with a report that he understands, not and what is applicable to him at that time when he's seeing the physician. Not just, hey, we did all these information, you have all this information, go home, and if you want, maybe you can get these things. No, it's very, very specific, it's individualized, and it's patient specific, and it becomes provider specific. That's what I can tell you about at this point.
And
Uh, Dr. Khanna, you talked to me earlier about a scoring methodology that you have developed that integrates this voluminous data dump that we all get. Like you mentioned how difficult it was to analyze. I myself tried doing it. It took me 10 days to integrate all the data, do all the evidence-based literature search, and then spend about 2 hours to manage one patient. At that rate, this whole business of integrating all the volume of data simply cannot be done by a physician.
see, when you look at amount of information flowing around, when you hear all the companies that are doing longevity medicine biomarkers, you see ads, function health, this health, that health, and offering cutthroat biomarker prices. Okay, it's a July 4th sale now. You can do 120 biomarkers for 199, etc. The problem is that they do all these high end biomarkers, a number of biomarkers, but then what to do with that? There's not enough continuity of care. There's not enough longitudinal hand holding by these companies regarding those biomarkers for the patients. So and then on the other hand, when you look at the longevity, what actually takes you down, what's the aging process, you need to understand that. So so all your cells start dying. They are not reproducing themselves, the new young cells are not coming, and then gradually the heart of the matter is the heart, as they say. So the cardiac or the metabolic issues, they come into play. So I put together a certain algorithm, a certain way of thought process which makes clinical sense, and parse these cardiac risk factors, metabolic risk factors, inflammatory risk factors, hormonal risk factors, assign them a certain value, put them all together, and come up with a centralized score which would depend upon good health of all these domains that I've just mentioned: cardiac, metabolic, all these things. So when you have everything put together, you come with a composite score, and that which you can hand over to the patient, that okay, your heart is this, has this much shortcoming, you are short on metabolic, this is what you need to do, this is what you need to do. So this is your score. Once you improve your cholesterol on the cardiac side, once you improve your insulin resistance on the metabolic side, once you improve your hormonal balance on the hormone side, automatically your score would improve. So you always strive towards your better score. What's your score today? So what it is going to be down the road. So that's the purpose of development of this app and the score, which rests on a certain algorithm that flows down, keeping into mind all these cardiac and metabolic and hormonal markers that are coming in.
Yeah, I had the benefit of getting access to your clinical, I call it intelligent assistant tool, uh, and I used it on a patient, a couple of patients in the last week or so, just to try it out. I want to get a feel for what's going on, like. And the one thing that I found most is that the graphical output of behavior, my biggest problem is I can tell patients that this is bad for you, this is bad for you, this is what I found most valuable in changing their behavior is showing them data in a way that actually incentivizes them to change and gives them a roadmap of how to reach there. This particular roadmap I have not seen before, which is why I actually, after using it, I got extremely enthused to get on the phone and say, Rajiv, I need to sit down with you and have an interview on this boardroom. Uh, and that actually brings me back to the question that you mentioned earlier in passing, and I want to drill down to it. Almost every doctor I have seen is brilliant in their ability to integrate medical information into treatment plans. They are all very good. They're all very powerful, humanistic people, able to relate to the patient. They are all abysmal business people. Or and the ones who are really good business people are not very good clinicians. So the you came out with something that allows the physician to not just be excellent in their area of expertise, you are giving them the Ayora Health platform, as you described it to me, gives them a one stop shop that allows them to actually be better than average in the one area that they all lack, entrepreneurship. Can you go a little bit into that?
So, Gurdeep, you want to take this question?
So yes. Entrepreneurship is, I think, something which is not as innate as clinical care of a patient is to us, and we have to develop that. And not everybody can develop that, and not everybody has the time. As you know, most of us work 14 hours, 16 hours sometimes, and at the end of the day, all you want to do is come back home and sit in front and vegetate in front of a TV or whatever your choice is. um, but what we have done with this platform is to try to make it much more easier for an individual practice to be able to enroll their patient. At the same time, when this patient gets enrolled, for them to be able to access uh, various different things on the platform. And I'll let Dr. Khanna tell you what all we are putting on this platform at this time. Go ahead.
So basically, Ayora platform, what we are trying to do is get all the services that can be useful to practice a meaningful wellness and longevity clinic under one roof. That comprises of, number one, doing biomarkers. Everybody's able to do routine physical with 50 60 biomarkers like CBC and chemistry and cholesterol and thyroid, etc. But when we start getting into a little bit more in vogue or in need, for example, I'll just take one example of cardiac. See, nowadays, till 2 years ago, 3 years ago, LPA was not part of routine discussion. Now, LPA, one of the genetic factors which tells you how evil is your bad cholesterol, that's becoming more and more commonplace. All the cardiology, when they talk, cardiologists, they recommend starting doing LPA. I have a lot of South Asian population, which is, there was a huge masala study got published that we need to start at least 10 years ahead in South Asian population by doing LPA and ApoB. So half of the physicians don't even know how to order. Most of the insurances still do not cover these tests. So those are the tests that knowledge, know-how we bring into our thing. So a patient wants to live longer. He needs to make sure that his heart keeps on working good. So he has to do little extra work to get all these panels. So under this platform, we've reached out to the big names in the labs like LabCorp, Sunrise, so to provide us with these ability to do these fancy panels. I would not say fancy, I would say much needed panels like cardiac, similarly hormone balance, male and female hormone. Similarly, there are inflammatory panels, the test that we can do. Patient comes to you, all my routine tests are negative, but I still feel so tired and achy and weak all every day long. There's certain kind of inflammation going on. We don't know where, what. So we can do those things. And similarly, we have gut panels, food sensitivities, etc. So we bring that know-how under this platform. We've already worked out with the lab companies to do these tests. A physician joining our platform simply has to click, and it's the platform, the test is ordered. Now, similarly, we have ability to do PET scans or a total body scans. We have the ability to get ordered and get taken care of cardiac calcium scoring or CT angios, things like that. But then the time comes to put it all together and interpret the data. That's where we introduced a Ayora Health app or Ayora Score, which takes all the data that is flowing in, put it into a simple app, and give out a meaningful clinical summary that the physician can take and sit down with the patient and show it to him and bind it together in a single score, which makes sense to them that I need to improve the score. To put all these things together, as Dr. Iyer, you said, every physician is a smart physician. That's why they are there where they are. But once you tell them, okay, you need to take care of insulin resistance even with normal A1C, and then you need to take care of your cardiac issues, you need to take care of your hormone balancing. You can take one thing at a time, but when you put it all together, you're spending few hours just to put it all together. This platform gives you that ability to do all these tests, do it under one roof. Ayora platform takes care of the business end of it so that you don't have to be involved in the business part of it, how to take care of the vendors and the business aspect of it. You just order, get the results. Even the results are parsed for you. You take those results and sit down and give your clinical judgment summary to the patient and show him the results in words that he can understand. And we have the ability to have the ancillary services like nutritionist help on our platform. If I need somebody to talk to a nutritionist, you just click a form. A nutritionist calls you, takes care of your nutrition needs. We have access to nutraceuticals. We have hooked up with one of the good nutraceutical companies, Active Power, as a start, who can provide with the recommended supplements if needed. So we are adding these kinds of ancillary services and putting them under one roof so that they can do that. There's a special services that Dr. Chhabra can provide, and he's sitting in Annapolis, and I have patients in DMV area. Nobody else does it. The platform shows that Dr. Chhabra is doing a certain kind of service. Nobody else has it. Those patients can, when they are on the platform, see what's happening. They can be referred, or then they can go to Dr. Chhabra, even from Northern Virginia, because that's a service nobody else is doing it. So we're bringing all the physicians together, giving them a tool, a kit to work to get all these things done, and put it in a simpler form to the patient. Gurdeep, anything I missed out or?
Yeah, so I think that's very, I think you did a great job. And one more, couple of other important things. So it's not only giving you also the platform which will help you to create a dashboard for your patients, and at the same time, with what our next generation is of this thing is going to do is be able to nudge the patient in the right direction, because we don't believe that there is one fix for all. We believe there's each patient, even if it's the simplest thing. Some people, with osteoarthritis may not be able to walk 10, 12,000 steps. Figure out another way of being able to handle the same issue, which is applicable to the specific to that patient. So we want to make it really truly precision, not just because it's the sexy way of saying precision medicine, but make it for that individual specific patient using AI as a tool to make that happen without spending a lot more time, but being able to provide good quality care instantaneously.
As always, Dr. Chhabra, you've been prescient. My next question was about precision medicine and the democratization of access. So I'll jump through that and not ask it, but I'll just summarize it. What I have gotten so far from what both of you have been saying is instead of providing these advanced form modalities of testing and treatment and prevention only to patients capable of wealthy paying thousands of dollars, your vision is to democratize this access to precision medicine so that community physicians can actually deliver sophisticated things within, and that is something that Ayora Health has put together in its as a mission statement and its promise. So going 10 years ahead, imagine we three are sitting down again a decade from now. Uh, I assume that my intention is to still be in practice at that time. I'm assuming that both of you are still there, or maybe we'll just sitting in the golf course. We don't know. Uh, but if Ayora Health succeeds exactly as the way you have described it, as you envision, what will have changed, not just for physicians and patients, but also for the healthcare system? What legacy do you think that this platform ultimately leaves behind? Anyone?
Dr. Khanna, you want to take that?
No,
Or
go ahead, and I'll just add on in the end.
Sure. So, I'd say, first of all, now I know why you're a TED speaker. You really know how to put things into perspective and bring all things together. You hit the nail on its head when you said we want to democratize medicine and all of that good stuff. Thank you for saying it in that fashion. And that is really our essential goal. Now, what do we want to do is even 10 years down the road is to be able to see how we can keep on doing that. Because I think for the current issue is that if you ask any new, fresh medical graduate or physician coming out, they always say, "Oh, yeah, you guys say that your residency was very tough, but you don't know how much more information we have to deal with." And I think this is our goal is to figure out a way where a practicing physician is able to keep on doing this on a day-to-day basis, where all this new information that's coming in, being able to pass it on a day-to-day basis and keep on evolving each day as a good clinician and provide really good care for the patient. Because as I tell my residents on rounds this morning, I was telling them, I said, hey, I have no problems with open evidence. I have no problems with Claude or Chat GPT. A lot of time you'll find a lot of academic physicians getting a little nervous about, oh, you're going to take away your clinical analysis thinking and all of this stuff. I believe that we need to use them. They need to be, we should be able to become better using those tools. And that's what we want to be able to do is provide that at that time when the patient is seeing you for that visit, the clinician should be able to say, yes, I have done what is available on today's date, everything possible, and I explain this to the patient. Because they shouldn't leave thinking that, oh, maybe there's something else that my physician didn't know about. So that's what the goal is about Ayora, this platform, as you said, bringing it to the community practice.
And make it so easy for them to understand this evolving information. See, AI is also bringing access to the physicians to all the newer researches, newer uh, revelations and medications. So, for example, as you read more about LPA, it tells you about LPA. I keep coming back to that because that is something which is evolving as we speak, day by day. Till today, there are no medications to treat elevated LPA. They are in phase 3 trials, and by 2027, they're hoping that there are 3 medicines that will be introduced. Whether, yes, they would decrease LPA, but whether that translates into reductions in mortality, morbidity, cardiovascular, we don't know. But we would know once it's there and more studies are done. But so AI is bringing out more and more information, access to the physicians. And what we want to do is bring all that information have them understand what this information actually means, and be able for them to put it in simpler words so that they can explain it to the patients and nudge it towards better health. One patient at a time, you start improving the community, and hopefully we can make a difference.
Gentlemen, I have for all the years in my practice, I have always heard people saying that we have to provide better quality for patients, better outcomes for patients. We have to shift the patient experience. I have never ever heard that we have to do that and we have to do the same for the physicians. And for the first time, it gives me great joy to actually hear this and be to know the two of you as people that I have shared patients with and call you as my colleagues. It gives me great joy to actually see this platform coming out that will actually heal both sides of the coin. Healthcare is not just healthcare for patients. Healthcare has to work for physicians. And you are talking of a vision of creating something that treats all parties in this equation equally, taking care of their concerns at each level, financial, health wise, and time wise, giving them back freedom to live, not just for patients to live, but physicians to live and get the one most precious commodity that cannot be bought, satisfaction. I applaud what you have created. This is something wonderful. I am eager to see what evolves in the next few months and years ahead. Thank you for coming on to Boardroom Reflections. This has been one of the most powerful interviews I have done in a long while. Thank you.
Thank you.
Thank you,
Thank
Dr. Iyer, for having us on your platform.